All right, once again, good afternoon, everyone. Welcome. And as I indicated before the recording started, we're going to be covering bleeding control today and burns. We're going to take a little break and we're going to start the occupational health and safety side of it afterwards. So I'm just going to mute for a little bit and I'll run the videos. Upon completion of the videos, we'll have a conversation and a discussion in terms of bleeding control. Okay? Right, so just let me know when it pops up on your screen, please.
Yes, sir, it's on the screen.
Skill. Bleeding control. Put on gloves and expose the wound. If gloves are not available, improvise a barrier. For example, consider using a plastic bag, plastic wrap, or extra dressings or cloths. If those are not available, have the person apply pressure with his or her hand. If blood is spurting, put on an eye shield or eye mask if available. Cover the wound with a sterile dressing. Apply direct pressure using the flat part of your fingers or palm of your hand to press on the wound until the bleeding stops. If you do not have a dressing, use your gloved hand. If the bleeding does not stop, add more dressings on top of the first one and press harder over a wider area. Do not remove a blood-soaked dressing. Instead, add a new dressing over the blood-soaked one. Apply a bandage firmly over the dressing to hold the dressing in place. If the bleeding continues, call 911 if not already done. If severe bleeding from an arm or leg cannot be stopped by direct pressure, consider using a tourniquet. After the bleeding stops, properly dispose of the gloves and wash your hands.
Okay, so that's the first part to manage external bleeding and open wound, but we have some supporting videos to go with it. So let me just get it here.
There are three general types of bleeding: capillary, where the blood oozes slowly from a wound; venous, where blood flows steadily from a wound; and arterial, where blood spurts from a wound. There are several types of open wounds: abrasions, lacerations.
Just I forgot to do the public service announcement. If you're afraid of blood or seeing blood and that kind of stuff, this might make you a little bit woozy. So just observe with caution, okay? Sorry, I forgot to give you the public service announcement at the start of the clip.
Incisions, punctures, and avulsions. Regardless of the type of bleeding or type of open wound, follow the same basic steps to control bleeding. Minor wounds can be cleaned with soap and water to prevent infection. Flush the wound with running water. Apply an antibiotic ointment and cover the wound.
Seek professional medical care for high-risk wounds, such as bite wounds, very dirty or contaminated wounds, crushing, ragged wounds, open fractures, wounds over a joint or tendon, and deep puncture wounds. For more serious wounds, cover the wound with a clean dressing and apply direct pressure. Then, apply a pressure bandage over the dressing and wound to maintain pressure and to hold the dressing in place. If direct pressure fails to immediately stop the bleeding from an arm or leg, apply a manufactured tourniquet 2 to 3 inches above the wound. For other body areas where tourniquet placement is impossible, such as on the chest, shoulders, or hips, stuff a hemostatic gauze dressing directly into the wound and apply hard direct pressure for 5 minutes or until bleeding stops.
All right, so that's the bleeding and wound care part of it. And the third video, we just open it here.
Skill, tourniquet application. If direct pressure fails, apply a tourniquet to control the bleeding. Call 911 if it has not already been done. Place the tourniquet firmly in place about 2 inches or 5 centimeters above the wound. Do not apply it anywhere other than an arm or leg, and do not apply it over a joint. Thread the Velcro strap through the buckle and pull firmly on the end strap to tighten the tourniquet. Pull the free end of the tourniquet to make it as tight as possible and secure it. Continue tightening the tourniquet by twisting the rod in one direction until bleeding stops. Secure the twisting rod in place using the Velcro or holder so that the rod does not unwind. Write the time it was applied on the tourniquet's tag. Do not cover, release, or remove the tourniquet. If massive bleeding continues, the tourniquet is not tight enough. Tighten the tourniquet. If still ineffective, apply a second tourniquet near the first, above it if possible. A second tourniquet is rarely needed.
Okay, so those were the three videos on external bleeding control, um, and management of these patients. Now, a key component of that is always starting with BSI, body substance isolation, and basically use of PPE to protect you, right? Um, Now, in the clip, you heard the person, the narrator, speaking about using your gloved hand and what you can do and those things, right? One of the things I must stress for the workplace, make it your business and find that first aid kit. Okay? Your first aid kit will have gloves. It will have a fair bit of bleeding control items. So it makes your job a lot easier. And of course, we apply direct pressure over the wound. Um, excuse me. Right. So here's a question for you. So we saw the video and in the clips there, this saw you applied direct pressure, you put a gauze over the wound. If blood soaks through the gauze, you put more on top of it. Why we want to pad more on top of the blood-soaked gauze and not remove that? Anybody knows?
It
Anybody
could
can
make it
get?
worse
Yes, you could make it worse. And how? How can that happen?
because, for instance, if you already put the gauze on there, it could be. How I explain this now? Um,
Take your time.
sorry.
You
You know,
lost
like
your chain
when
of thought.
pardon?
You lost your chain of thought there.
Something like that.
Yeah, yeah,
I was
yeah.
trying to say that like when the cut like the scab start to form, when you
Right.
remove the
Okay.
gas, it
Good.
might stuff and it start bleeding more.
Good. So I understand what you're saying. So, but we're actually not so far down where a scab starts. It's actually the initial forming of a clot. A scab is when the clot hardens over a period
Yes,
of
it's
days, right?
clot I was trying to say. Clot I was
Yeah,
trying to
good.
say
Yeah,
when
yeah.
the
So
blood
I
clots.
thought you lost your chain of thought there. But that's good. That's actually the answer I wanted. So thank you. Right. So typically when we apply pressure to a wound and we bandage, the body's clotting mechanism starts to kick in because you would have slowed down the blood loss, allowing the clot to start to form. By removing a blood-soaked dressing, we're going to be removing any clot that has formed. Okay, we run the risk of doing that. Okay, so sorry. So that's why you want to pad more dressing on top of it and bandage your wound. Okay. We use a tourniquet for large wounds. Let's say if there's an artery severed and blood is spurting or spraying, if a limb has been severed and those things, right? But of course, the tourniquet is only applied to the arms and the legs, or as we say, the upper and lower extremities. Okay. And that itself helps to control the bleed. Now, many years ago, just over, I would say 2.5 decades ago, the tourniquet was not used because there were concerns about its effectiveness and doing more harm than good. But again, thankfully, through research, we've seen the benefit of using the tourniquet, and it's once again being recommended over the last few years. Okay. Now, if you don't have a commercial tourniquet like the one you saw in the clip there, you could improvise. I mean, we've seen and heard of situations where people they've used their belt, they've used a towel or strip of cloth or even a shoelace. Okay. But very important is for the first aider, you apply a tourniquet, you take a note of the time it was applied. So when the ambulance arrives with the EMTs or you get to the hospital with the patient, the doctors could now assess has any damage been done to the limb because of the tourniquet being applied, what's going on, what's the status, and all these things. Okay, so yeah, that's why we apply the tourniquet and how we go about doing it. Okay. You'll find countless videos on YouTube on how to apply a tourniquet and so forth. Okay. YouTube really works for getting a lot of educational videos as well. It's not just for entertainment for a lot of people who want to look at clips and videos on YouTube, but there's a lot of educational content on there as well. Okay. Um, Very important here for small wounds, you want to wash the wound. Okay. You don't need to get any antibacterial soap and all these things. Normal household soap and water would work. Okay. So if I think Lifebuoy is known across the Caribbean, right? Tell me. Everybody know the soap called Lifebuoy? I see one person, two person, yeah.
Yes, sir.
Good, yeah. So we all know Lifebuoy, right? Lifebuoy works just as good as any antibacterial soap. All right. So yeah. What we don't want to do is do things like putting hydrogen peroxide on an open wound. Right? Hydrogen peroxide, yes, it'll kill bacteria, but it damages and kills good skin tissue as well. Okay, so we don't want to do those things. All right. So any questions on bleeding control, everyone? No questions? Okay, so I have a question for you guys. and it goes back to the clip there, right? How do you know um how tightly are you supposed to bandage the wound? So we see you put the gauze on and then you wrap with a bandage. But how do you know what is it, how tight this is supposed to be wrapped? Anybody? So you'll have to forgive me if you hear a lot of movement. It's just that I need to keep moving around a little bit, otherwise I might end up starting to cough a lot more than I am now. Okay? So how do we know how tight we're supposed to bandage a wound? Anybody? Nobody?
I can make a try.
Go ahead, sure. Ask away, answer away, man. That's what we're
Yeah,
here for. We're here to learn, right?
yeah. Um, like not well tight enough to restrict the bandage from shifting,
To
but
restrict it from
n-
shifting. Uh-huh.
but not too tight to where the patient losing feeling in their arm.
Right. Okay, good. So you're heading in the correct direction. And I'll accept that. We'll just get a little more specific, right? So typically, bandages for bleeding control are elastic, whether it's the conforming stretch bandage, commonly referred to as the cling in hospital, or it's the conventional elastic bandage that everybody want to wrap their ankles when they're going to play football. All right, Jamal, you do that? You wrap your ankles when you go to play football?
I don't play football.
You don't play football? Why?
I, I do track and field.
You do track and field? Okay.
Yes.
All right, all right. But you ever play football?
Yes, I have.
You ever see any of your colleagues wrapping their ankles and stuff when they're going to play football?
Yes.
Right, and it's the same elastic bandage. Aaron, you play football?
Not often, no.
But you play, and I'm sure you've seen people wrapping their ankles, right?
Honestly, no.
No?
It was just like regular high school sweats. I haven't
What
played
the
football in
hell is
years.
this, boy? I spent a night in the hospital and thing. I swear my foot break where a guy hit me a tackle and my ankle swollen like it was, you could have used my ankle as in your football. How big it was swollen, but that was when I was fit. I just gained a lot of weight and slowly becoming a couch potato. But anyway, that's another story. Um, yeah, so it's the same elastic bandage, right? And how do we know how tightly we wrap? Well, two things. As I think it was Aaron who made the comment, right? If when you wrap, the person's fingers, the nail beds, start to turn blue or start to get pale, or they feel the pins and needles, then you have wrapped too tight. You are restricting circulation to the fingers. All we want to do is control the bleed. We don't want to stop circulation. Um, and ideally, you've wrapped tight enough. If after you've wrapped the bandage, you can insert one finger under the bandage with minimal effort. These are elastic bandages, so they will tighten on their own. It will naturally close in and contract and tighten. We just want to be able to insert one finger under the bandage. It's just a test to see. So let's say you wrap at the wrist. When you finish wrap, you just as a test. So if you use your watch band, if you have one on watch, and let's say the watch is the bandage, once you can easily insert one finger, just one finger, not two, not three, just one finger, usually your index finger, under the bandage with minimal effort, then you've wrapped tight enough. You should feel the bandage giving some sort of restriction on your finger. You've wrapped tight enough. Okay, if the bandage is loose, it will move. We don't want that. Okay, somebody else coming in. Okay, remember when we're looking at bleeding control, if there's a break in the skin, you will see the bleeding. This is called external bleeding. If there's no break in the skin, obviously the blood is trapped internally. That's internal bleeding. Both types of bleeding are of no value to our bodies because it takes valuable blood away from the circulatory system. Blood that could normally be used in the transport of oxygen, nutrients, and the removal of waste products such as carbon dioxide. All right, so that's any questions on bleeding control, guys, ladies? Janelle, Priyanka, Jalicia, Chrissy, Khadija,
No, sir.
Soraya, Victoria,
Okay,
Tanya,
so
Afron.
so it's bleeding control, you said?
Yes, yeah.
Right, correct.
All right, so we're good with that. Okay, good. Nice. So, let me just get the moving on. I want to look at where is this? I just want to get the video on burns, right? So I get it here. I just open it. Right, so I'm going to share the video on burns, and we'll just pay attention and we have a discussion afterwards.
Burns can be serious and painful injuries. They occur when tissues receive more thermal energy than they can absorb from sources including heat, chemicals, or electricity. Burns can be described by the extent of damage, often referred to as first, second, or third-degree burns. These are also known as superficial, partial thickness, or full-thickness burns. To decide how to care for a burn, and if more advanced medical care is needed, determine the degree of the burn. Next, determine the size or extent of the burn by using the rule of the hand. Because the victim's hand represents about 1% of the total body surface, estimate the extent of the burned area by the number of hands. Identify affected areas of the body. Burns on the face, hand, feet, and genitals are more severe than those on other body parts. Burns can often be more severe in the elderly, the very young, and those with other injuries or pre-existing conditions. Care for first-degree or small second-degree burns by immersing the burned area in cool water or applying a cool, wet cloth until the burn is pain-free. For first-degree burns, apply aloe vera gel or a skin moisturizer to help keep skin moist and avoid itching and peeling. For small second-degree burns, those affecting less than 20% of the body, apply an antibiotic ointment and cover the burn loosely with a dry, sterile dressing. For large second-degree burns and all third-degree burns, cover the burn with a dry, sterile dressing and bandage loosely. Care for shock and call 911.
Okay, so we're gonna resume here because I really don't know when with Zoom that it reset and log back. Mm. I really don't know what happened there. So let me just continue from here.
To help keep skin moist and avoid itching and peeling. For small second-degree burns, those affecting less than 20% of the body, apply an antibiotic ointment and cover the burn loosely with a dry, sterile dressing. For large second-degree burns and all third-degree burns, cover the burn with a dry, sterile dressing and bandage loosely. Care for shock and call 911. Chemical burns occur when caustic or corrosive substances touch the skin. Remove the chemical as quickly as possible. If the chemical is a dry powder, brush the powder from the skin before flushing continuously with water. Remove contaminated clothing and jewelry as soon as possible, and seek medical care. Chemical injuries to the eyes require immediate care. Hold the eyes open and flush continuously with water. Loosely bandage both eyes with wet dressings and seek medical attention. Electrical burns occur when electricity enters the body at a contact point. The current travels along the path of least resistance, often through the nerves and blood vessels, until it finds an outlet, usually contact with the ground or another object. The characteristic entry burns on the skin may appear small, while the exit burns are often larger. Major damage during electrical burns occurs inside the body. Before caring for electrical burns, make sure the location is safe by unplugging, disconnecting, or turning off the power. Check to see if the victim is responsive and breathing. If the victim fell during electrocution, check for other injuries. Care for shock. Cover the burned area with sterile dressings, bandage loosely, and seek medical attention.
Okay, so let me get your questions on burns. You must have one or two questions, I'm sure.
They didn't really explain the rule of the hand properly to me.
The rule of the
The rule of hand or something.
right. So typically the rule of the palm is to give us an estimate of how much body surface area has been burned to the patient, right? Now, in order for us to do that, we use the patient's palm, the size of the patient's palm, as an estimate. All right. Typically, your palm is supposed to represent, I believe, 1% of the body surface area. So, for example, if the chest area has been burned, by estimating how many palms it would take to cover the burn area, you get an estimate of how much body surface area has been burnt. But it is not absolutely mandatory for the lay person to remember that. If you could remember that and get the information, great, but don't take on too much time trying to figure out that. Your focus should be on managing the burn, such as getting the person away from the source of the burn, whether it's heat, chemical, or electricity, right? Trying to cool the area if possible using running water, or if you have heat cooling pads or something along those lines. And of course, monitoring the patient and calling for help. Okay? Anybody else? Nobody else? Anybody ever get burned while ironing clothes or get burned with wax or anything like that?
Yes, sir.
One person, two. Anybody else? Ladies? Three. And I'm sure if it's a small burn, it was probably very painful, right? So think about if it's a large area such as the chest, the torso, chest and the abdominal area, or if it's an entire leg. Now, here's the thing with this now. Just wanna pull up a image here. Let me just find the image and I will share it with you guys. Let me just go back into one of the PowerPoints I use. I'll just get into it here. All right, so let me share it. Excuse me. So on your screen here, what you should be seeing is a cross section of the skin. And for those of you who doing anatomy, this should be very easy, right? This is and we're looking at the basic and the simplest levels here. When we're looking at burns, we classify burns based on how deep it penetrates into the skin, right? And so when you hear a first degree burn, it's usually what we call a superficial burn, okay? And by superficial, we mean just the top layer of the skin is affected. So, and this would be the epidermis. So on your screen, you should be seeing the area tagged as the epidermis. And usually it involves the outermost layers of the skin. A second degree burn, however, penetrates, excuse me, a second degree burn penetrates deeper into the skin, usually into the area with the dermis. And here you will find a lot of the sensory nerves. You may see some blood vessels and all these things. And usually a second degree burn is very painful, mainly because you have the stimulus continuously being exerted onto the sensory nerve. Okay. A third degree burn is usually the worst type of burn you could get. And with the third degree burn, the whatever is causing the burn has penetrated deep down past the dermis, and it may go through the subcutaneous tissue. It may even go through the fascia and to the muscle. Third degree burns are the worst type of burn you can get. And typically what you'll find is with third degree burns, the area of the third degree burn is usually painless. And I say usually, and if you hear any noise before a cough, is because I'm trying to cover the microphone with my hands to ease up the noise with the coughing, right? Um, Third degree burns because the sensory nerves found in the dermal layer, they've been destroyed. Usually there isn't any other sensory nerve around this area to collect the stimulus, the signal, and send it to the brain for you to know, hey, you're getting burnt. So I remember, so my brother is a firefighter, and he was actually telling me about an accident they went on, they responded to, and there was one occupant trapped in the vehicle, and the vehicle was on fire, and he was actually trying to climb out of the window of the vehicle, right? And he was wedged tightly into the vehicle based on how the vehicle compacted from the accident. But the vehicle was on fire, and he was screaming in pain with the his legs on fire and all those things, right? Until my brother told me, until he told him it not hurting anymore. Why that happening? Okay, so everybody, the firefighters, the EMTs, everybody knew what was going on, but nobody was gonna tell him. They were able to they were able to cut him free from the vehicle, but he sustained third-degree burns from the just below the belly button, go down both legs and stuff, right? And he didn't survive. He died, I think, 3 days later in hospital. So yeah, third-degree burns are the worst type of burn. So just remember this. First degree burns, superficial layer, the outermost layer of the skin, the epidermis. Second degree burn, the dermal layer, partial thickness. into the area with the blood vessels and the nerves and so on. And of course, third-degree burn may go all the way down. Okay. Um, all right, so let me just stop the share on this one and just try to pull another one. I want to show you a picture and see if you guys can recognize this. I'm just trying to get a picture here. Control bleeding. Uh, Let's try to find it here. It's on one of the trauma. Right, good. So let me share this one now on. Again, so this one is from the emergency medical responder program that I teach. And we're looking at burns here, right? So this one is superficially first degree burn. It's really a sunburn, a really bad sunburn. But the next one here, right? This second degree burns. You all know what these little swollen areas are? What we call that? Anybody? You know what we call that?
Blisters?
Well, yeah, blister, but was it was so for those of us here from Trinidad, was our
Water
local
bladder.
huh?
Pus?
No, not pus. What's our local term for this?
Water bladder.
A water bladder. Right. For those of so for our Caribbean colleagues, what do you guys call it? So you get burned, part of the skin area swells out and there's actually fluid under there. So it's a thin layer of skin with fluid underneath. What you guys call it in your country? No answer? Nobody from any other Caribbean island here? You don't recall hearing it. What country you from again, if you remind me? Antigua, okay, all right. So I went to Grenada to do some training a couple of years ago, and I know some of the guys there, they refer to it as a water plug. We call it a water bladder here in Trinidad, and I guess some people may not have heard that, but anyway, it's actually a blister, right? And we don't want to puncture that because now we're creating an open wound, making the area susceptible to infection. Okay? How do we manage burns? Get the person away from the source, whether it's heat, chemical, or electricity. Cool the area for about 10 to 15 minutes. Usually that should be sufficient to get the whatever is causing the burn, whether it's heat or chemical, that should be removed, right? If it's chemicals, you try to remove as much as possible before you flush with water. Because some chemicals, when they react with water, the reaction is exothermic, so it's going to produce heat, and that's going to exacerbate an already bad situation. Okay? Dealing with electricity, make sure power is off from the area before you get to the patient. And of course, in your first kit, you should have burn dressings. Burn dressings, they differ from the regular dressings for bleeding control because when you look at one side of it, it's shiny. It looks as though there's a layer of plastic on it, and they are basically non-stick. So you can actually put that with a shiny plastic side over the burn, and you can remove it without it sticking and without adhering and tearing the skin and stuff. Okay, so your first aid kit should have burn dressings. If it doesn't, some companies or some workplaces normally have a separate burn kit, especially if the organization does a lot of welding and fabricating and all those things. Okay. All right. Any questions on burns? No questions? Everybody good with that? So again, so I made a, let me just stop the recording for this. All right, guys. So continuing here, we would have finished with the burns clip and the discussion. And now we're going to look at the introduction to occupational health and safety. And of course, we're going to start with the history and development of occupational safety and health. So this PowerPoint is just about 20 slides long, 20, 21 slides long. And as I said, it contains an overview. Uh, Within this, we will continue our discussions in the next class with respect to certain concepts that were identified in this. Okay, so let's start. What is occupational safety and health, right? Occupational safety and health, or OSH as commonly referred to. Some countries refer to it as occupational health and safety, or OHS. That's okay. Each country has their different terminologies. As some of us would say, um, health, safety, and environment, HSE. Some organization would say safety, health, and environment, SHE. Okay, so I'll give you an example here in Trinidad and Tobago. Where I work, my job classification is the Group Health, Safety, and Environmental Manager, right? One of the other companies I worked with previously would have been, I was, my job title was HSE, Health, Safety, and Environment Technician. There's a company in the Point Lisas Industrial Estate here with Canadian roots. Their manager for occupational health and safety is called the SHE manager, safety, health, and environment. But despite the terminologies, it's still the same field, looking at occupational health and safety. Okay, so OSH, or occupational safety and health, focuses on the protection of workers from health and safety risks at work. And there's a reason for that. And when we look at the history, we'll get an understanding why. Okay. So the presentation here this evening, where we're going to look at the evolution of OSH from the pre-industrial times, and yes, from that time, coming up to modern practices, more modern day practices. Okay. So before the Industrial Revolution or the pre-industrial era, we're talking about hundreds of years ago. Okay. There were safety concerns, but they existed, but they were less formalized. People just had an idea that, hey, the work we're doing, things could go wrong, this could happen, that could happen, somebody could get injured. Um, okay. And because there was no formal structure, right, workers were basically responsible for their own safety. So we did not have a occupational health and safety management system. We did not have a HSE coordinator. We did not have a safety officer or HSE advisor. We did not have risk assessments. We did not have policies, procedures, protocols in place. So workers were basically left to fend for themselves. All right. And when we look at the history and we look at research um, in the pre-industrial era, ancient civilizations, we have examples of safe work practices uh, being implemented. So some of the examples we have here, again, these are the pre-industrial era, right? The ancient civilizations, hundreds of years ago. There were examples and of miners using protective gear such as helmets. Okay, we had craft guilds introducing apprentice training, and there were protocols for some of their trades. In Egypt, what was found is doctors were assigned for certain areas to manage persons who got injured, to try to nurse them back to health. There was even a separate area for placement of injured workers. Okay. Greece, there is evidence that discussions were had on proper tools, creating and designing and creating proper tools for personnel to use while at work. So it's not that nothing was discussed. Um, Typically, human nature, looking at various work and questions started arising. And of course, as any logically thinking individual, when you start to see instances of human injury, the same type of injury taking place, then naturally you'd want to try to figure out, can I do something or can something be done to prevent these injuries? Because every time a worker gets injured, a worker is unable to return to work for a period of time. And especially in ancient times where we did not have all these modern equipment and treatment facilities, um, workers may be some time away from work. Some workers, their injuries were so severe, they died. Okay, so the data is there. And if you were to refer to the text, the occupational safety and health text, you would you would see a lot more examples of instances where there were concerns about worker safety and worker health from those civilizations coming up. So fast forward a bit to the Industrial Revolution, okay, where now we've moved from hand tools, manual labor, and we're moving towards industrialization where steam-driven equipment, a lot of steel frames, steel structures are being erected. Mankind is progressing with industrialization and development. With that, we have more risk taking place. Steam-driven equipment, you have now concerns. We have now concerns about burns from steam, explosion with the vessel, the integrity of the vessel, all those things. So with this increase in urbanization and the plethora of industrial plants and factories being constructed and being operationalized, we saw there was an increase in occupational accidents, work-related accidents. Okay, so, okay, who's that? Can you mute, please? Thank you. So in order to try to manage this, what was found is measures were being looked at. And in Britain, somebody, right, in Britain, we had the first factory legislation. But contrary to popular belief, this initial factory legislation was okay. Let me just pause here for a sec. Right, somebody, Miss Thompson, when you log in, I'd like you to mute, please. All right, so good. Right. So contrary to the popular belief that when legislation was enacted, it's all about worker safety. It is not the case. If you look here, let me just maximize this. The first introduction of factory acts in Britain, 1833, was primarily aimed at improving the working conditions of children in textile factories by setting minimum age limits for employment, restricting working hours, and mandating some basic education for child workers, whilst also establishing a system of factory inspectors to enforce these regulations. One of the things that happened is there was actually an outbreak of fever among children, especially in the cotton factories. Right. So the powers that be decided to look at this and based on public pressure, public agitation, public pressure, legislation had to be enacted. Right. And some of the measures also included the development of better ventilation systems. So when you hear about a sweatshop, and if you do some research on that, and maybe you may have heard about sweatshops in the Middle East, sweatshops in Eastern countries of the world, and so forth in those areas. These things actually happened. And in some parts of the world, it may be taking place. Okay. So with the measures being implemented, we looked at better ventilation systems in the workplace, protective clothing, the creation and the utilization of safety equipment, all designed to provide protection for the workers. But this was during the Industrial Revolution. And as time progressed, eventually, when we look at the UK, we had the enacting of the Health and Safety at Work Act. Now, there was some research done prior to that with Lord Robbins and these guys putting forward the case for legislation. Hence the reason that we went the UK went to and enacted the Health and Safety at Work Act 1974, commonly referred to as HASAWA. All right, when you hear a HSE person refer to the HASAWA Act, it's actually the Health and Safety at Work Act 1974 in the UK. In the United States of America, we had the Code of Federal Regulations, the CFR. So if you've done OSHA programs, you may see 29 CFR 1910, whatever, whatever. All right, I think there's a typo here. All right. 29 CFR 1910.186 or 270 something, depend on the applicable standard. Okay, and it's based on the Code of Federal Regulations. So these acts were put in place and the respective agencies developed to enforce the legislation, to work towards ensuring compliance with organizations. In Trinidad and Tobago, a couple decades later, we had the Occupational Safety and Health Act 2004, amended 2006. Now, there's one piece of legislation that's actually in place before the Occupational Safety and Health Act. Anybody knows what that legislation is? Anybody can give me an idea what it is? Anybody? And we looked at factories. So that's your first clue. Feel free to go online and do some quick research and find it, you know. Anybody knows what it is? Anybody found it? So somebody type something here. So nobody knows? Let me just stop the share for a second. Who's gonna volunteer to do a quick online search and find it? Nobody want to volunteer? Anybody want to do a quick online search to find it?
I'll get in the Walsh-Healy Act.
Mm,
Factories Ordinance of 1948.
that's right. That's what we're looking at for Trinidad and Tobago. The Factories Ordinance of Trinidad and Tobago enacted in 1948, right? And again, its purpose at that time was to regulate safety in factories, in industrial facilities. Okay. And based on the Factories Ordinance legislation, it led to the creation of these titles, these job titles, factory inspectorate. And their role was basically to go around and ensure industrial facilities were compliant with the requirements of the ordinance. Eventually, this was replaced by the Occupational Safety and Health Act 2004, amended 2006 here in Trinidad and Tobago. Right? What was found is that the factory ordinance was old, outdated, and the scope was too narrow. The scope needed to be widened to properly manage health and safety in the workplace. Okay, so let's get back to this here. So, a lot of organizations, in their attempt to become compliant with the legislation, um, they develop and implement a management system, which we'll look at in detail later on down the road. Okay, some of the most common health and safety management systems we have in the UK, we have HSG 65. Within recent times, we have ISO 45001. Um, previous prior to ISO 45001, there was OSHAS 18001, 18002. Now, these are all background information for you, right? We have not started to touch on hazards as yet, but it's pretty important that we get some of the background information in. OSAS was replaced by ISO 45001, a comprehensive framework. Now remember, the legislative guidelines provide you the minimum standards. A lot of these management systems, organizations can go ahead and purchase a template that they can now apply to their individual organizations and become and tailor it. Ultimately, they may actually achieve a level of compliance that is above the standard, above the minimum standard prescribed in the various occupational safety and health legislation. Okay. And even when organizations looking for international compliance, let's use, for example, a company in Trinidad looking to provide services for an international petroleum producing organization. The standards may in a lot of cases may far exceed the minimum legislative standards. So what some of these organizations actually do is aim for compliance with the organization's guidelines, and by doing so, they're sure they actually would have exceeded what is required for the legislative compliance. But make no mistake about it, any organization's HSE guidelines, HSE management system, HSE policies must not contradict what the law states, what the legislation of the land states. Okay, it must never contradict what the legislation states, because then it would be in breach of the legislation of the laws of the country. Okay, so that's just three of the more popular health and safety management systems, HSE 65, which you'll find primarily in the UK. Some organizations outside of the UK may have adopted it, but most within recent times, most of the organizations, they would have moved from the OSAS to ISO 45001. Some organizations tend to, smaller organizations, who are just aiming for compliance with the legislation, they may do a tailor-made package within their organization that addresses the requirements of the act only. That's all well and good because yes, it provides you with the minimum guidelines, but you're compliant with the legislation, and at the same time, you are providing a level of protection for your workers, management, proper management of risk within the organization, hazard mitigation, emergency response measures, and so forth. Okay, so moving on, we have some terminologies we want to look at. And well, the first one we have here is occupational health, and this is described as the maintenance and promotion of workers' health within their work environment. Okay, whatever work, workplace you're at, occupational health is critical. And when we're addressing hazards and looking at risk management, we must look at the impact the work activity, the hazards of the job have on the health and safety and well-being of the workers. Hence the reason why we have health surveillance and scheduling for annual medical examinations, screenings, and so forth. Occupational safety, the protection of workers from workplace hazards that could cause injury. Again, risk management, risk mitigation, hazard identification, and development of guidelines to manage your risk and in some cases, as much as possible, remove the risk to provide a level of protection for the workers. What is a risk assessment? It is the process for identifying hazards and assessing the risks associated with them. Okay, so we'll look at that. We look at in its framework. How do we manage risk? How do we look at risk? How do we calculate it? How do we manage it? PPE, personal protective equipment, the gear or equipment worn to reduce exposure to hazards. I think that should be self-explanatory. And for a lot of you who in the MLT program, I'm sure you're very aware of what some of the PPE required for your job would entail. What is health? Health is described as the absence of disease. Now, there's some other descriptions. Let me just get one here. I'll just stop the share here for a sec and go back to, I'm actually on the manual itself, the reference manual, trying to get to the correct page here. Right. Just trying to get the definition here. There was some two aspects of it the author would have identified. We just share it here. Right. So safety versus health, right? And we have varying descriptions of what health and what safety are. Well, they're closely related, but they're not the same, right? So we see here, if you look, we just try to looking at safety. One view is that safety is concerned with injury-causing situations, whereas health is concerned with disease-causing situations, right? So here's another view. Safety is concerned with hazards to humans that result from sudden severe conditions, whereas health deals with adverse reactions to exposure to dangerous but less intense hazards. These are just some examples. So they have many, many different um, examples of what health is, what safety is. Okay, so it's easier for us to very simply say health is the absence of disease, and safety is the absence of risk of serious personal injury. Not every time we'll be able to remove the risk or remove the hazards, but through sound risk management practices, we may be able to reduce the exposure level, reduce the severity of the hazard, and ensure that the exposure to workers is minimized. Welfare is access to basic facilities, washrooms, lunch facilities, potable drinking water. Okay. Depending on your workplace, you may want to have there may be employee change rooms, lockers, even shower facilities. Hazards are something or anything with the potential to cause harm. Risk is the likelihood that a hazard will cause harm, and these two, they tie into each other. So the likelihood that a hazard will cause harm in combination with the severity of injury, damage, or loss that might occur. So the hazard is whatever has the potential to cause harm, and the risk is the likelihood that this hazard will cause harm to someone. But we also combine the likelihood with the severity of what can happen to somebody when exposed to this hazard. So for example, let's use an example here. The risk attached to cutting coconut. We look at the hazard, cutting coconuts. So let me just, somebody share. What could happen to you if you cut a coconut? What could happen? The worst case scenario that could happen to someone cutting a coconut. Anybody tell me?
You could chop your hands.
You could chop your hands. Yes. You could actually cut off fingers. You could even cut off several fingers. Right? So that's the severity, the worst case scenario. The hazard here is a laceration, right? Or an amputation. Okay. So a chop wound. When we're looking at trying to calculate the risk with it, we look at what the hazard is, the likelihood of this hazard happening, multiplied by the severity of what could happen. So the likelihood you could chop yourself, and if you chop yourself, what is the worst case scenario that could happen with it? And we usually use a scale. So the most common scale is a 5x5 matrix, which I'll show you later on down the road. So we wouldn't get confused. We're just on the introductory phase right now. So to calculate risk, it's always likelihood by severity. The likelihood of it happening, and if it happens, how severe the condition is. So typically when we're looking at assessing and managing hazards and risk in the workplace, we do an initial assessment, get a rating, so that's your initial risk rating for this particular activity. And then we implement recommended measures to manage this situation. And we look at the rating after we have implemented control measures. As much as possible, we always try to eliminate the risk, the hazard, sorry. But based on the type of activity. So the coconut, you had to chop the coconut. What's the other option? You go and you buy a bottle of water. What if you want the jelly? Now this comes at increased cost. So this is where we start to look at all the other factors. But let me not get too far ahead of myself here. Right, so let's come back to this. Still on just the terminologies. Right. What is an accident? It is an unplanned, unwanted event that leads to injury, damage, or loss. So in HSE, you will see a lot of these terminologies: an accident, a near miss, dangerous occurrence. You may even see an observation. So an accident is an unplanned, unwanted event that leads to injury, damage, or loss. A near miss is an unplanned, just as an accident, unwanted event, just as an accident, that had the potential to lead to injury, damage, or loss, but did not actually do so. So a person walking and a bolt fall from a scaffold and hit the guy on his head. It's an unplanned, unwanted event that leads to injury in this case. The guy walking, the bolt fall, but it landed in front of him. Same unplanned, unwanted event. It had the potential to lead to injury, damage, or loss, but it did not do so. It didn't hit him, but it could have. And now you do an investigation to find the root cause and look at control measures to prevent this from reoccurring. A dangerous occurrence is a specified event that may have to be reported to the relevant authority by law. So here's a question for you. Stop sharing. Here's a question for you. We all know the incident in Point Up here, right? You all know the incident in Point Up here that took place a couple of years ago?
Yes, sir.
Right. Do you think that needed to be reported to the respective agencies?
Yes.
Yes. Plain and simple, yes. And this was the most glaring example, right? And yeah, I worked on that day, as I was telling the Saturday class. I worked on that day, met with all the guys, signed off their work permits for the land-based activities. And normally, as I do, I tell them, guys, be safe out there, have a good one, right? Land-based activities took place without any issues, but the offshore activities, well, we saw what happened. Okay, so yeah, tragic, really, really tragic. All right, so let me go back to the share here. Right. So how do we describe the study of health and safety? It involves the study of many different subjects, including the sciences. So we're going to have a bit of chemistry, we're going to have a bit of physics, we're going to have a bit of biology. Okay, because it involves sometimes forces impacting on the body. We may deal with chemicals, we may deal with physics and movement. Okay, but also engineering, psychology, when we're looking at behavior-based safety, sociology, and of course the law. So it's a little bit of everything, a whole set of, or as you say, as one person, one HSE professional told me, it's a melting pot of everything. And we need to be exposed to each aspect of it. Okay. So in occupational safety and health, there are many barriers to good standards of health and safety in the workplace. Barriers or obstacles or obstructions, if you want to use them. Number one, workplaces can be complex. It's not the run-of-the-mill one thing taking place and that's it. A lot of times in the workplace, you will have what we call SIMOPs, simultaneous activities or simultaneous operations, competing and conflicting demands placed upon people and organizations. You may have to meet a deadline for a particular activity, and at the same time, another target pops up, and now you have to figure out how do I juggle these two. You might have a third one coming in as well, especially in fast-paced environments. Good health and safety practice often relies on the perfect behavior of individuals who sometimes do not behave in the ideal way. You will have some people compliant all the time. You will have some people compliant the majority of the times, and you have some people just refuse to be compliant. And we need everyone to be on board on the same page. Okay? So, for the workplace to be compliant, a lot of times we need these people, those who do not behave in the ideal way, to understand safety is also their responsibility and they are required to comply with the necessary or the applicable guidelines. And a lot of times, now Trinidad and Tobago, we've come a long way in terms of occupational health and safety, occupational safety and health. We've come a long way. We have a lot of HSE policies, guidelines, procedures, legislation in place, all these things. So you find that a lot of workers understand the importance of complying with guidelines. I don't want to use the word rules, I'll use the word guidelines. Okay. And even though that is the case, you will still find examples of workers who understand and they know what the correct procedures are, but they choose to disobey. Today is what, Tuesday, so Friday last week, I just popped in to work just for literally 10 minutes. And we have some renovations taking place to the lobby of our facility. I was not there for a month. And lo and behold, I am looking at two guys on a mobile scaffold. They have their harness on, but part of this is, in addition to wearing the harness, because you're working on an elevated platform, it needs to be anchored. So in the event they slip and fall of the harness, of the scaffold, the harness serves as a fall protection device. They're not going to slam into the floor. Okay? It's going to protect them, suspend them, and give them enough time to get off, or for someone to come and help rescue them. I am looking at these guys, they're wearing the harness, but they're not tied off, as we say. So let me just pull a picture of a harness here to explain what I'm speaking about. Some of you may not know what it is. Right, good one here. Nice one here. So for those of you who don't know what a harness is and why and stuff, right? So let's use not this one. We'll use this one on the left here. Right. So this is the harness with a lanyard. So this long rope here is called a lanyard, and at the end, you have two D-rings that is supposed to be anchored. So if you look at the guy on the scaffold here, let me just see if I can magnify this a bit. Right. Okay, so you guys seen it on your screen here? Tell me, you guys seen it on your screen? Let me know, yes or no. Somebody answer me, please.
Yes, sir.
Yes, sir.
Right. So what's going on here, right? This guy's on a scaffold and he's wearing a safety harness. And with the harness, there's usually the lanyard, which in this case would be this here. And to walk now, what's supposed to happen once he's going to be doing work? This here, the end piece here, two D-rings are supposed to be attached to an anchor point. So in this case, he may want to attach the anchor point to, let's say, across here, or it may be somewhere higher up. And the reason for that is if he were to slip off this beam here, this platform, and fall, this lanyard helps to suspend him. Remember, the end piece here, the D-ring is connected to one of these beams here. And what it does, one of these pipes here, what it does, it helps suspend him. Now, this little piece at the end here, let me see, right. This piece here will extend out. So it helps to reduce, it does not shock him and stop right there. It gradually, it's a retractable, right? So gradually, um, it will reduce the rate at which he's gonna fall, and it would provide a level of protection for him. So he doesn't slam into the ground. Okay. What happened when I went to work last day? Just for 10 minutes. These guys were on a scaffold. They had this on, but this piece here was not anchored to any area of the scaffold. You know what the correct thing is, but they're not doing it. And that's the main challenge when we're dealing with health and safety. A lot of times you have workers who understand what the correct activity is, what the correct thing should be, and they're not doing it. So as a HSE professional, you have to find a way to convince people to do the correct thing at all points in time. Some organizations use behavior-based safety to try to encourage change from within and to get the worker to do a behavior change. Some organizations use punitive measures where they punish you through fines, through suspensions, and those things. Okay. A lot of times it requires you to look at each situation. Sometimes it is just a matter of having a conversation because you may have forgotten it. Sometimes you need to be more stern because it's a deliberate action. So an occupational hazard, moving on, is any source of potential harm or danger to workers that could affect their health or safety in the workplace. So I will insert here, think about your workplace and your job function if you're employed and try to identify some occupational hazards. So you could do that on your little downtime or when you're doing your revision. Think about your workplace and try to identify some occupational hazards. Okay. Again, we're still on the overview. Hazards. It's a broad term, right? What are hazards again? Let's go back and see. Something or anything with the potential to cause harm. But hazards can be broken up into different categories. So we see at the first one, a physical hazard. Examples, noise, temperature extremes, radiation, vibration. These are examples of physical hazards. Chemical hazards, as the name implies, chemicals, dust, fumes, gases, vapors. Biological hazards, living organisms, insects, vermin, bacteria, viruses, fungi, and other microorganisms. Ergonomic hazards, workplace, workstation design, repetitive motions, heavy lifting. Psychosocial hazards, stress, harassment, violence, work-related mental health issues. And each of these hazards we look at when trying to manage workplace safety. Okay, so how do we address them? We look at the work activity, we look at the risk attached to it, and then we use a hierarchy. It's called the hierarchy of controls. We always try to eliminate the hazard. If it's not possible, we go to the next best one. Elimination, substitution, engineering control, administrative control, and then of course PP. And it's here. So control measures according to the hierarchy of control. Always look at trying to remove the hazard or elimination. Sometimes the work activity makes it impossible because the task itself, removing the hazard means you're unable to accomplish the task. In this case, cutting the coconut, you need to use the cutlass. So unfortunately, we cannot remove the hazard in this case. Substitution, we try to replace the hazard with a less harmful one. Look at the cutting of the coconut. We may be unable to do that. We can't peel the coconut. You have to cut it. Engineering controls are designed to isolate people from the hazard using things such as machine guarding, physical barriers. So one of the things you could do is instead of holding the coconut with your hand, you put it on a block. Instead of using a long cutlass, you may want to use a chopper. So it's a combination of substitution and engineering control. Another option is what? Think about it. What else can we do? Change the manner in which you cut the coconut. I've seen some guys do that. Instead of the angle they're cutting, they change the manner in which they just make four chop and literally lift a lid off the coconut and they put a straw in there for you. Few and far between. But with as we go lower down in the hierarchy of controls, you'll realize the hazard is still there. Administrative control change how people work. And this is where you look at training personnel to execute the task, scheduling personnel, and so forth. So nobody gets overworked, and that way you're always able to pay attention to the task. And of course, PPE, personal protective equipment, the use of protective gear to reduce exposure. Now, when you look at managing hazards and controlling hazards, there's this concept that PPE is your last line of defense. And you would hear people saying that, your last line of defense. One of my lecturers, when I was doing my degree, actually two lecturers told us this is not the case all the time. Because sometimes the control measure to properly manage the hazard might be a bit expensive and it takes time to procure. So as an interim measure, they may look at providing additional PPE to the workers until maybe the equipment to eliminate the hazard or the equipment that can be substituted is in place, or the engineering control, it takes time to fabricate. So years gone by, we would hear PP as the last line of defense, and you would hear people still saying that. But strictly speaking, it's not that way anymore, especially in the workplace. Okay. When we're looking at effectiveness, well, then we go based on the hierarchy of controls here. The effectiveness of each control measure. Obviously, elimination will remove the hazard. Substitution, we look at a less harmful one. So instead of using one toxic chemical, we use a less harmful one, a less corrosive one. Okay. Engineering control, we develop measures such as machine guarding. So you know there's a conveyor belt moving there. You install a guard so nobody's hands and fingers could get trapped in the conveyor belt. Administrative control, you roster workers, okay, you schedule some of the high hazard activities for times when you have the least amount of workers in the area or in the workplace. Some of the high, the loud, noisy activities can be scheduled at a time when less workers are on site. So you reduce the amount of workers being exposed to the loud noise. And of course, the provision of personal protective equipment for the workers who are actually there. So application is how to apply these controls in the workplace to minimize risk. Again, risk is likelihood by severity. And next class, I'll do a longer presentation on how do we manage risk. Okay. So some of the traditional health and safety interventions include preventative measures, where you have engineering controls such as ventilation systems, safe machine guards, administrative controls, PPE, worker training and awareness, providing education on the activity, what could happen if you're exposed to the hazard, and the necessary control measures, who can be affected, the severe consequences of exposure to the hazard, severe consequences of unsafe work activities or work actions. So when we're looking at occupational safety and health, one of the areas that always pops up is responsibility. Whose responsibility is it? Your duty of care. And the respective legislations try to address these things. So in terms of your employer's duty, they are required, if we look at our legislation here in Trinidad and Tobago, the employer is required to provide a safe work environment. And what is a safe work environment? One where we manage the risk properly, remove risks that could be removed, and the rest we manage them. Provide adequate training, equipment, and hazard controls. But it's not just about the employer. We look at the employee as well. Workers have a responsibility. They have a duty. And some of these duties are to follow safety procedures, report hazards they've identified, and use the safety equipment properly. So let's step away from the workplace and let's look through our minds back to the COVID pandemic and the wearing of face masks. I am sure at some point in time you would have seen people with the face mask pulled down so the nose is exposed, or they wear the mask on the chin. That's not the proper way. They know better, but they're not doing it properly. Okay. So in terms of managing safety in the workplace, the employer and the employee both have responsibilities that they must comply with. Legal requirements. Various laws and regulations hold both employers and employees accountable for health and safety. And when you look at our legislation, it's the same thing. employers, actually it's on the next slide here. The Occupational Safety and Health Act 2004, amended 2006. And this is Trinidad and Tobago. So for a colleague in Antigua, you'd have to look at your legislation. And it may not be phrased the same way, but generally the concept of employer and employees' responsibilities should be in the legislation. Okay? So the primary objective of this legislation or this law, the OSH Act, is to reduce workplace hazards and implement safety and health programs for both employers and employees. It's not just one group only. Okay. Now, employers can also benefit from having a safe and comfortable work environment for their employees. Remember, workers are comfortable, productivity increases, and this in turn generates high profitability and ultimately growth. Let's look at rights and duties. Employees, and this is exactly how it was in the act, right? I believe it's type 4, but again, I have to pull it out. It was in the act. A safe and healthful workplace. I believe it should have been a safe and healthy workplace. They must have a right to know about hazardous chemicals. They have a right to report injuries to the employer, request hazard correction from the employer. So if they've identified a hazard and they've reported it to their employer, it is the employer's responsibility to address it. Training. Again, they have a right to training in the workplace. Training about the task, the job function, utilization of equipment to manage emergencies such as fire extinguishers, fire hoses. File a complaint with OSHA. They have a right to do that. Be free from retaliation for exercising safety and health rights. A lot of times workers complain that they state they are afraid to raise anything because they could get victimized or they could get fired. You are supposed to be free from retaliation for raising your concerns. Likewise, duties of the employers, provision and maintenance of plant and systems, handling, storage, and transport of equipment, machinery, articles, and substances, provision of suitable PPE. So you're not supposed to run in the parlor and buy a pair of gloves and bring it back. We look at standards based on the work activity. So for example, the gloves you use for welding would not be the same gloves you would use to handle food. Provision of appropriate information, instruction, training, and supervision to provide workers with the necessary knowledge, skills, and tools to safely execute their task. Provision of adequate amenities and arrangements for their welfare tools, such as washroom facilities, lunchroom facilities, okay, potable drinking water, employee lockers, depending on the facility, shower facilities. We don't expect them to be in a five-star restaurant, but five-star hotel, sorry, but they need to be comfortable and the amenities as per the requirements of the legislation. It needs to be provided. I think we're almost done here. So you would see this term a lot when we're looking at managing risk. Reasonably practicable. Reasonably practicable is a legal concept that refers to the extent to which an employee must take precautions to ensure safety, whilst at the same time balancing the risk against the effort, cost, and time needed. Sometimes the control measures to be implemented to eliminate the hazard may be so costly It affects the financial performance of an organization, especially for small businesses. So you know what? We look at reasonably practicable. We manage and we say, look, you know what? Elimination, too expensive. Substitution, still too expensive. Wait, you know what we could do? We could do an engineering control. So instead of buying a totally new conveyor belt that might cost $500,000, all right? You know what we could do? We could hire a company to build some machine guards or some screens that might cost $50,000. Work takes place. We've successfully managed the hazard and we're still able to operate. We're no longer we're not bankrupt. So we always try to balance the precautions against effort, cost, and time needed. So some key points. Reasonably practical considers the severity of the hazard and the likelihood of harm. And this is where we assess our risk. It doesn't require the elimination of all risk, just reasonable steps to reduce it. That's it. Reduce it. Inform the workers what the control measures are, what they need to do to protect themselves, sign off on it, and we let them work. Of course, we're going to be monitoring to ensure they don't do the wrong thing. Right. Key takeaways. Occupational safety and health have evolved significantly over time. We know that from the ancient civilizations to the industrial era to now. The understanding of hazards and control measures is rooted in both historical developments and modern practices. And of course, the roles and responsibilities of both employers and employees are critical to maintaining a safe work environment. So let me reiterate, it is not only about the employer having a responsibility. It is both the employer and the employee. It is of no benefit, sorry, to the organization if the employer spends $100,000 on personal protective equipment for everybody, and then you take your steel toe boots and you sell it. You come to work with slippers the next day. You take your lanyard and you leave it home for when you have to climb up to paint your house. No. What is provided for work, you need to use it at work. And if you're not sure, you ask. And this is where training and retraining comes in. Safety requires continuous effort. If we don't, people will get complacent. Okay? So that is the PowerPoint there for the introduction. As I said, it's just an overview. We touch on a couple items. And as we continue into this session, we're going to spend some time looking at risk. We're going to look at hazards. And of course, your group assignment will involve taking a particular hazard and doing some research on it and and presenting to me or submitting to me. Okay? All right. Questions. Let me hear you guys. No questions? Everybody stunned? Everybody, what's going on? Everybody saturated? Tired? Jalecia, tired? Janelle, Vincent, Jamal. Who's iPhone? Glenor, are you here? I saw your name. You type in your name. You here? He had to step off. Aaron. Oh, he said, okay, yeah, okay, I understand. Aaron, Chrissy, Priyanka, you guys, all right, cool. You guys,
I'm here.
you guys stunned into silence or what? Oh, okay, cool. Type in your name on the chat, right? Okay. All right, guys. I think I'm okay, good. I think I'm gonna let you guys go. And tonight I'll upload a lot of stuff, and this time I'll save it on the e-classroom. All right. So if nobody has any questions, remember your homework with the role of the various organizations. Email it to me. Can 3 people do the homework? Yeah, sure. Don't see why not. All right, 2, maximum 3. Okay, just make sure everybody's names, no more than 3, maximum 3. Make sure everybody's names are on the document you're emailing to me. All right. I will put my contact email address on the WhatsApp chat so you guys will have it. Okay, guys, ladies. Janelle, you okay? Oh yeah, so the homework is actually somebody screenshotted it, right? Did anybody screenshot? Okay, good. Did anybody screenshot it?
Yes, sir. I sent it in the group.
Okay, good. So it's on the group. You'll see Unit 4, Role of Voluntary Organizations. What I want to know is these organizations, Red Cross, St. John's Ambulance, any government organization such as the ODPM, and any other organization such as an NGO, what their role is in disaster relief and emergency response and so forth. Okay? It's due on Friday. I'll give you until midnight Friday. I know I said it could be done in pairs. I'll allow you to work up to a maximum of 3 people. Okay? There's no points for this. No. One person could email. Okay. I haven't created any group, so I'll just allow everyone to socialize and find themselves in part of a group. If you're not part of a group, you could reach out. If you want to do it individually, I have no problem with that. It's totally up to you guys. The assignment, the project, this is homework. The project, next class, we will put everybody in groups. Okay? Those who don't attend will be placed into a group. So we'll select 6 group leaders next day, and these group leaders will select personnel, and those who are absent, I will place them into a group. Okay? All right. If you want to do the homework on your own, I have no problem with that. It's not going to be graded in any case. All right, ladies and gentlemen, if everybody's names are on the chat.
Sir, excuse, I'm not
Sure.
a part of any chat. I believe
You're not a part of the chat?
a screenshot and sent to the chat, so I don't know what
Okay,
is being
so
missed.
can somebody who created the WhatsApp group again? I forget. Who
So I
created?
did.
Okay, good. So can you liaise with Tanya? She she created the WhatsApp group, so you may have to just message her your phone number, or she may, however you guys want to do it, and she will put you onto onto our WhatsApp group. All right. Anybody else who is not on our WhatsApp group, um, liaise with Tanya, and she will right. So I see she put it on the chat there, so you can use that and get get onto the WhatsApp group. All right, guys. All right, so for the rest of you, I think that's it for the session this evening. Well, I apologize for the intermittent coughing, but as you realize, I'm getting better. Not 100% there yet, but I am getting better. And I'd like to say thank you very much for your patience and your understanding for the 2 sessions that we missed. We'll make up for it though. All right, guys. So have a good night. We'll touch base next week at the same time. Okay. All right. Let me stop your recording here.